channel, My Expert Doctor. I am Dr. Shalini Singh Salunke with you. I'm working as consultant physician. Now, before starting today's video, it is very important for me to share with you three of my observations in the second wave of COVID. The first one is the second wave is much severe compared to the previous phase or wave. More and more people are getting infected in shorter duration. One patient is coming today, and within 3 days, 3, 4, or the entire family members are coming. This means that this phase is more infective, this wave is more infective compared to the previous one. The second important point is, which I want to share with you, is previous infection history do not give you immunity towards or against the new infection. That means if you have got infected in the previous wave or a couple of months back, a few months back, doesn't mean that you will not acquire this infection again. There is equal even if you have taken vaccine, you can get infected. So, although we have observed that after vaccination or previous infection, the severity of the disease is not that much, but still there are chances for you to get infected. So beware. The third important point is, unfortunately, in this wave of COVID, we are seeing many young patients also coming to us with infections, as well as getting hospitalized, or few of them are even requiring ICU setup. To explain this point, let me share you the moment when we are talking, when I am discussing this with you. I have 3 patients under me in ICU care. One of them is in the age group of 20 to 25, the other one in the age group of 30 to 35, the third one in the age group of 60s. What does that mean? What does it tell us? That at whatever age group you belong to, you can get infected severely, requiring ICU admission. I'm sure you must have heard about the sad news regarding a senior reporter of a news channel, Aaj Tak, who lost his life due to COVID. He was in his early 40s. In a similar incident, an international bodybuilder belonging to Maharashtra in his early 30s lost his life to COVID-19. Now these two people were young. Plus, the bodybuilder was physically very fit, as I am sure you are all aware how much they have to work out to be at the bodybuilder level. Now, so when they are so much fit, physically fit, healthy, yet they got infected and they lost their lives. What have we learned from this? Prevention is better than cure. I'm sure you must have heard about this thing hundreds of times, but this is the time to follow it. You have to start following the 12 steps of precaution, which I have told you in my last video. If you have not seen that video, please go and watch it. The link is given in the description box below. And start following it heartily. You have to do that to prevent yourself from getting infected. Because there is a vaccine for prevention. There are steps of prevention, but there is no 100% treatment available for COVID yet. Now, let's start with today's topic. As I have promised you, I will discuss about the symptoms and cure of corona. But this, as we have to discuss everything in very detail, so I think that it's better that we divide this video into 2 parts. In the first part, we are going to discuss about the symptoms that you have to recognize at the early stage, so that you can isolate yourself and connect to your consultant or to your doctor. What are the labs or tests which you need to do, and once on the basis of your symptoms and your labs, how are you going to get categorized into mild, moderate or severe category patients. In the second part, we will be discussing about the home quarantine rules. What does it mean? We all know that 80% of the people do not require hospital admissions. They will get better staying at home and following certain guidelines and rules and some treatment. So we will be discussing about that. Plus, we are also going to discuss about the precautionary steps that you have to take so that your family members will not get affected by this disease while you are staying in isolation at your home. We will also discuss about those 15 to 20% of unfortunate people who will require a hospital administration or might require ICU admissions. So we will discuss about the red flag signs, that are the symptoms which you must be aware of. If they're appearing in you or your relatives, you have to rush to the hospital and arrange for the bed. We will also discuss about the remdesivir, Actemra and other medicines which are discussed on media, social media and many other places couple of months. What are their efficacies? What are these medications? And are they of that importance the way they are portrayed? We will discuss about everything in the second part. So, without wasting any moment, let's start with the first part of the topic, that is the symptoms of corona. Let's start with today's topic, that is symptoms of COVID-19 or corona. So, you might develop some cold, sore throat, cough, low grade fever. What does low grade fever means? Temperature about less than 100 Fahrenheit. You may develop headache, weakness, body pain. Specifically, we have seen that people complain of body pain in the lower part, that is below back, at the back and in the legs. A few people also complain of loss of appetite. People may develop loss of taste and smell. There are certain atypical symptoms of COVID as well, which we are seeing now in the second wave. This was there in the first wave as well, but not that much, not predominantly. So those atypical symptoms are nausea, abdominal pain, mostly in the lower part. You may develop some loose motions, rashes or redness of eye. So these are all the symptoms of COVID. Now it is not important for you to have all symptoms together or 2 or 3 of them. Even if you develop single symptom from this list, you need to go to a separate room immediately, isolate yourself from your family and friends and other people. Start using a mask and gloves. Immediately call your doctor. That might be your family doctor, or you can go for an online consultation, which we call televisiting now. Call them, tell them about your symptoms. They will plan some lab tests for you. So immediately go for the lab test. So what are the lab tests which you are going to do? First one is your CBC, which is called complete blood count. Now why is it required? The most important thing here is your WBC count, which is called white blood cells. There are 2 parts of WBC counts, the lymphocytes and the neutrophil. So in your blood report, they are going to see whether your neutrophils are on a higher side compared to your lymphocytes. This is called NLR, neutrophils to leukocytes ratio, lymphocytes ratio. Then this is a marker of severity of the disease, one of the markers rather I should say. The second important test is CRP, which is called C-reactive protein. Now this is an inflammatory marker which will tell how severe is your infection and or where can it reach in on a severity scale. Along with that, they will ask you to do a D-dimer, which is a marker which tells about the clotting system of your clotting factors of your system. In COVID, we have seen that there are patients who develop thrombogenic or clotting mechanism in the body, and small clots are formed which in the later stage can contribute to formation of pneumonia. So D-dimer is an essential factor. It should be done in the initial stage. Apart from that, we also do ferritin, which is also one of the markers of inflammation. So these 4 blood tests are usually advised by your doctors, and they are very important to be done on day 1 or as early as possible, because this will be the baseline test. Now if you develop some severe symptoms or some other complications on day 6 or day 7, so we will have a baseline test to compare, to see the trend. That is why they are very important. Now apart from that, we will go with imagings. Among them, the first and foremost is your chest X-ray. We will see whether there is some evidence of pneumonia in your lungs or not. Apart from that, we will do an ECG that will help us to understand the base level cardiac activity of your in your body. Apart from that, the most important thing which will tell you whether you have a COVID infection or not is your COVID-19 RT-PCR. Now, RT-PCR is a swab test. They will take swab collection from your nose and from your mouth. Usually this report takes 24 hours to come, But unfortunately, in current scenario, people are various labs are taking approximately 6 to 7 days because they are loaded with the samples. So you are not getting lab reports as early as it should be. So if you are not getting this report, you can go ahead with rapid antigen test. Now this report is not as sensitive or as confirmatory compared to the RT-PCR, but the report is available to you within 2 to 3 hours. So you can go ahead with this only if your doctors ask you to do so. Okay, so now let's talk about categorization of the disease. We have learned about the symptoms, we have learned about the lab test. Now what we will do is, we'll combine these two things and we'll categorize as a patient into mild, moderate or severe category. So what are mild? Around 80 to 85% people will fall in the category of mild disease. Around 15 to 20% will fall in the category of moderate to severe disease. Those who might require hospital admission or ICU admission. So first of all, we'll deal with mild diseases. These people might have simple symptoms like cough, cold, sore throat, mild grade, low grade fever, some little body pain and weakness. They may be asymptomatic as well. We have seen many patients do not develop any symptom. They just go because they have a history of contact with some COVID positive patient and they get tested positive and they do not develop any symptoms over a period of 10 to 14 days of their quarantine. So those people are asymptomatic. Now there are certain people who have mild symptoms. Then these people do not have any pneumonia on their X-ray. They have CRP. The range is between 0 to 5 or 0 to 6 depending on that. But the CRP level of the patient should be less than 25 to call that patient as mild disease patient. If you are doing your HRCT, the CT severity score should be less than 8 out of 25. Then your saturation level, your SpO2 level should be, your oxygen level should be more than 95%. So these are the people who will fall in the category of mild disease. Now what's the moderate disease? So the patient will be symptomatic. They will have all these symptoms like we have discussed in the mild category. Along with that, they will have some little dyspnea. What does dyspnea means? Some difficulty on breathing or shortness of breath. Their respiration rate will be more than 24. Their saturation level or their oxygen level will be somewhere around 92 to 94%. That is less than 95 but more than 90 or 92. They will have some pneumonia in their lungs. If they have done their HRCT or CT scan of the lungs, they will get score between 8 to 16 out of 25. Their, as I have already mentioned, that their oxygen level will be around 90 to 95%. Their CRP will be between 25 to 100. Now let's talk about the severe patients. The patients with severe disease. They will have severe dyspnea. They will have breathing difficulty also when they are sitting, when they are talking or while they are eating. Even that much severity of shortness of breath will be there. Apart from that, their respiration rate will be more than 30, their oxygen level will be less than 90%, their CRP, C-reactive level protein level will be more than 100. If they have done their HRCT or CT scan of lung, the score will be more than 16. So all these are the characteristics of patients who have severe COVID-19 disease. So in this video, we learned about the symptoms of corona infection and what lab tests your doctors might ask you to do, and then the categorization of patients on the basis of severity of the disease. This was all about today's topic. Now what we are going to discuss in our next part or next video is what to do with the home quarantine rules, how to save your family members from getting infected, and a little detail about the talks of the town, that is the remdesivir, Actemra and certain other drugs which are supposedly said to be efficacious in the disease. What is their efficacy and are they really reliable? So this was all about today. Now if you like the information, please hit the like button, share it with more and more people so that they will get benefited out of it, and please do not forget to subscribe for the notifications of the upcoming video. So this is all for today. Stay safe and stay happy at your place.